What does a sunken fontanelle mean for infant dehydration? Imagine a soft spot on a baby's head that suddenly looks lower or more sunken than usual. That's what a sunken fontanelle looks like. Fontanelles are the soft, flexible gaps between the skull bones that allow a baby's brain to grow and the skull to be flexible during birth and early childhood. There are two main fontanelles, the larger front one and the smaller back one. When a fontanelle appears sunken, it can be a sign that the baby is not getting enough fluids. This condition is called dehydration. Babies are especially vulnerable because they have a high surface area relative to their weight, which means they can lose fluids quickly. They also have immature kidneys that aren't as good at conserving water. Dehydration can happen fast during illnesses like vomiting, diarrhea, or fever, which are common in childhood gastrointestinal issues. A sunken fontanelle alone isn't the only sign of dehydration, but it's an important clue. Other signs include dry mouth and lips, fewer tears when crying, fewer wet diapers, dry or cool skin, sunken eyes, a fast heartbeat, rapid breathing, and tiredness or sleepiness that seems unusual. In serious cases, the baby might look very ill, with skin that doesn't bounce back when pinched, and they may be less alert or responsive. While dehydration is the most common cause of a sunken fontanelle, it can also be related to malnutrition, especially if the baby isn't gaining weight well or has very dry, inelastic skin. However, this is less common in areas where children usually get enough nutrition. If a parent notices a sunken fontanelle, especially along with other signs of illness or dehydration, it's very important to see a healthcare professional quickly. Dehydration can get worse fast and become dangerous if not treated. A doctor will examine the baby, check hydration levels, and ask about recent illnesses, feeding habits, and urine output. Sometimes blood tests or urine tests are needed to see how dehydrated the baby is and to find out what caused it. Treatment depends on how dehydrated the baby is. Mild dehydration might be managed by giving more fluids through breastfeeding or bottle feeding. If the baby cannot take fluids well, is vomiting a lot, or shows signs of severe dehydration, they may need fluids given through enrollment in a hospital. Caregivers should never try to treat serious dehydration at home without medical help. In managing childhood illnesses, recognizing a sunken fontanelle as a sign of dehydration is crucial. Acting quickly can prevent complications and help the baby recover faster. Always seek medical advice for an accurate diagnosis and the right treatment plan tailored to the child's needs. In summary, a sunken fontanelle in an infant is a key sign that often points to dehydration, especially during illnesses like gastroenteritis. It's a signal that immediate medical attention is needed to assess the cause and severity, and to start appropriate treatment to restore fluid balance and keep the baby safe and healthy.